In order for us to understand the heart better and the structures better, I want us to imagine the heart is a house. Now, take for example, the house is not just made up of walls and pins. You have the roof, you have foundation. When you come inside, you have pipes running from inside the house to outside the surroundings of the house, on the walls and all, on the ground. You usually have wires, electrical works that runs from inside to outside of the house, probably even on the ground. Now, the heart is equally that way. The roof of the house, when we come to the heart, it's called the base of the heart. The base of the heart. The foundation, let's call it the apex of the heart. Now, the walls is where we now talk about the pericardium and the layers of the heart. So that's what we're going to be focusing on this video. Oh yes, and if you're wondering what the pipes and the wires are likened to, the wires, let us call them the nerves. The wires are the nerves, and the pipes, we call them the blood vessels of the heart. Because you remember, so if you look at your houses, there are certain pipes that are bigger than some. So just take the bigger pipes as the aorta or the pulmonary arteries, while the smaller pipes are the arteries, the pulmonary veins, and other smaller blood vessels. So in this video, we are going to be focusing on the layers of the heart. In an examination, there are certain confusions that I've seen students experience. When asked, mention the layers of the heart, some students will go this way: pericardium, myocardium, endocardium. Someone will say, "Are we not correct?" Of course not. You are not correct. The correct layers of the heart are the epicardium, the myocardium, and the endocardium. So let us identify them. But we are going to be starting with the pericardium so that you have a better understanding of what the pericardium is. Now, the pericardium is like in fact, it is a fibrous sac. Fibrous, anything that is fibrous in nature is tough, is strong. It cannot easily be expanded. It cannot easily be stretched. It's very thick in nature. So let's use this as an example. Suppose this is your heart. Ever wondered why your heart is able to stay in place and not drop into your thoracic cavity? The reason for this is because of this nylon we'll be using to represent the pericardium. Your heart is encased in the pericardium. The pericardium is a fibrous sac that holds the heart in place to the sternum. The sternum is this bone here, which your ribs are attached to. So it holds it in place in the sternum and equally the diaphragm. The diaphragm is a dome-like muscle that aids in breathing. So whenever it holds it in place, it protects the heart. Remember, it is fibrous in nature. It protects the heart from damages. So if we were to look at our diagram here, this thick-looking structure, this one here, this thick-looking structure here is what we call the pericardium. The pericardium. Now remember, the pericardium we say is a fibrous sac. But the pericardium is actually divided into two layers. Yes, that is where the first layer of the heart will come in very soon. The pericardium is divided into two layers. That fibrous layer is what we call the parietal layer. The parietal layer. And it has another layer. After the pericardium, we have another layer called here, the visceral pericardium. The visceral layer of the heart, of the pericardium. The visceral layer. If the parietal layer of the pericardium is fibrous in nature, take note. The pericardial layer of the parietal layer of the pericardium is fibrous in nature. The visceral layer of the pericardium is serous in nature. Serous in nature. It is not tough. In fact, it is smooth. Not just smooth, it's slimy. In between these two layers, remember we call them a layer. And remember it is a pericardium. In between the parietal layer and the visceral layer of the pericardium, there is a space. If you look closely at this diagram, there is a white space here. That white space is what we call the pericardial space. And the pericardial space houses fluid called the serous fluid. The serous fluid. This serous fluid, for knowledge purposes or examination purposes, contains 10 to 15 mils of serous fluid in it. 10 to 15 mils. What is the purpose of the serous fluid? The serous fluid acts as a lubricant between the parietal layer of the pericardium and your heart. To illustrate, if you take a glass, a very smooth glass that is flat, place it on the ground or on your table, pour water on top of that glass, make sure the film of water is covering that glass. Take another glass and place it gently over that layer of water on that glass. You will notice that you can easily glide the glass on top over the glass under. The reason for this is because of the water you put over the film of glass. So it's the same thing between the pericardium and your heart. The pericardium, the reason why your heart, you are not feeling sharp pain is because of the serous fluid between the parietal layer of the pericardium and the visceral layer of the pericardium. Well noted. Now, what more is there to see? For the confusion we mentioned earlier for the layers of the heart, why some students would select pericardium as the first layer of the heart, they are not completely wrong. In fact, if you are part of them, you are not totally wrong. In fact, you are partially right. Here's why I say so. The visceral layer of the pericardium is what forms or is what makes the first layer of the heart. Again, the visceral layer of the pericardium is the first layer of the heart. And that visceral layer of the pericardium is what we call the epicardium, the first layer of the heart, the epicardium. The epicardium has a serous layer, is a serous layer. And this serous layer is what produces that serous fluid between the parietal layer of the pericardium and the visceral layer. Remember, the visceral layer of the pericardium is the epicardium. The serous fluid is formed by the serous layer of the pericardium, or is formed by the epicardium. What else is important to note for the epicardium? The epicardium houses or welcomes blood vessels. They welcome nerves and they welcome lymph vessels. So if you were to ask, what is the physiological importance, or what are the importance or physiological significances of the epicardium? One, the epicardium is the visceral layer of the pericardium. It is serous in nature and it equally houses and welcomes the blood vessels of the heart, the blood vessels coming into the heart, nerves, and lymph vessels. Now let's just talk about, let me put this here, epicardium. Now let's talk about another layer. And this layer we're going to be talking about is the most important layer of the heart. You know why? It's because this layer of the heart is responsible for the pumping action of the heart. Remember, it's the circulatory system, and that is the main function of the heart. Now, the second layer of the heart is called the myocardium. The myocardium. Look at how thick this is. Yes, myocardium. Myocardium is the muscle of the heart, the main muscle of the heart. The myocardium is responsible for that pumping action. It helps the heart to pump blood. In fact, every single electrical activity that is produced in the heart goes to the myocardium, helping it to push out blood to the heart. So, if you were to be asked, what is the physiological significance of the myocardium? The myocardium is responsible for helping the heart to pump muscles. It's responsible for helping the heart to pump blood around responsible for helping the heart to pump blood around the body. The third layer. The third layer of the heart is located within the heart. It is what lines up the chambers of the heart. It is smooth in nature, and it prevents the flow of blood from experiencing turbulence within your heart. It is smooth. And the name of that layer is called the endocardium. So, physiological significance: endocardium is smooth in nature, preventing turbulence, and it lines the chambers of the heart. Epicardium is fibrous and is serous in nature, and is responsible for the production of serous fluid. The myocardium is muscular in nature. And well, if you are asking, the muscles are striated, but they are all connected. So at least there we have it, the significance of the heart. What about clinical significance? In the clinical setting, or maybe when you're writing your examinations on the disorders of the heart, you'll be coming across things like pericarditis, endocarditis, myocardial infarction, myocardial ischemia. Now, exam notes. Whenever you come across anything like itis after a word, itis or itis, this means inflammation. So pericarditis is inflammation of the pericardium. It swells, it becomes tender, and as a result of that, when your heart is beating, you'll be feeling sharp pain. Myocardial infarction, or in myocardial ischemia, where there is reduced oxygen supply or blood supply to the heart muscles, the patient will complain, or the individual will complain of sudden sharp pain or chest pain, because the heart muscles is no longer receiving enough oxygen, O2, or blood. Endocarditis, in terms of where there can be viral infection or bacterial infections, the endocarditis can become inflamed, and it could equally lead to other complications as well. For example, aortic stenosis, tricuspid valve insufficiency, and many more. Because of endocarditis, there might be that inflammation within the endocarditis can lead to more complications. So you see, when you understand the structures of the heart, that is the base, the foundation of equally coming to understand disorders that occur within the heart. So at least there we have it. We've come to understand the outer structures of the heart, the layers of the heart. We've come to see that the pericardium is a fibrous sac that encases the heart and protects it from damage. We've come to see that the epicardium, which is the first layer of the heart, is literally the second layer of the pericardium. We've come to equally know the function, the physiological significance of the myocardium and the physiological significance of the endocardium. We've equally seen brief circulations of the heart, how there is systemic circulation and pulmonic or pulmonary circulation going on around the heart. And something else you notice here, this swirling motion I formed here is simply how the muscles of the heart are connected in bands, but here they are interlocked. If I'll put it that way, they are interlocked or they are connected to each other. So whenever it is the heart muscles beat, it moves in and it moves. It's like a twisting motion. That twisting motion is because the muscles of the heart goes round around the heart, and that makes that first twist or contraction first affects the atrium, the second the ventricles. So in our next video, we'll be talking about the cardiac conducting system of the heart. And after that, we are going to be going into it properly, understanding the blood vessels of the heart. We'll be talking not just the heart, the circulatory system. Remember, we're talking about the circulatory system and the cardiovascular system. So the circulatory system, we'll be talking about the structures, the veins, the arteries, the capillaries. We're looking at the internal structures, and we are equally going to be looking at the coronary arteries of the heart. The coronary arteries are responsible for supplying the heart its own oxygen and nutrients. So, and even blood, because just like every other organ, the heart too equally needs oxygen. So very soon we'll be concluding. We'll be making more videos regularly on cardiovascular system, but very soon we'll be concluding the anatomical structures and the anatomy and physiology of the heart. Catch you in the next video. Thank you.